Mental Health Alternative Therapy Quiz Questions. Question 1. In pediatric mental health, there is a lack of sufficient numbers of community-based resources and providers, and there are long waiting lists for services. This has resulted in select one that doesn't apply. Option A, children of color and poor economic conditions being underserved. Option B, increased stress in the family unit. Option C, markedly increased funding. Option D, premature termination of services. The correct answer is option C, markedly increased funding. The lack of resources in pediatric mental health leads to underserved populations, increased stress in the family unit, and premature termination of services. However, markedly increased funding does not align with. Question 2. Why is it important to establish a contract with a client with an eating disorder at the beginning of treatment? Option A. The client and healthcare provider form a partnership that is challenging for the family to disrupt. Option B. A collaborative approach to treatment planning ensures that both physical and emotional needs will be addressed. Option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Option D. Permission for refeeding is crucial as it can have adverse effects. The correct answer is option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Establishing a contract with a client with an eating disorder at the start of treatment is crucial to involve the client in decision-making processes. By engaging the client in decision-making, it enhances their. Question 3. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A, has no memory of the physical abuse he endured. Option B, using both alcohol and marijuana. Option C, often reports being unaware of surroundings. Option D, reports feelings of not really being here. The correct answer is option B, using both alcohol and marijuana. The correct answer is B, because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 4. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A, high-protein foods. Option B, high-fiber foods. Option C, tyramine-rich foods. Option D, low-fat foods. The correct answer is option C, tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 5. What assessment question will provide information to the healthcare provider regarding the effects of a woman's circadian rhythms on her quality of life? Option A. How much sleep do you usually get each night? Option B. Does your heart ever seem to skip a beat? Option C. When was the last time you had a fever? Option D. Do you have problems urinating? The correct answer is option A. How much sleep do you usually get each night? The correct assessment question to understand the effects of a woman's circadian rhythms on her quality of life is to inquire about her sleep duration. Circadian rhythms significantly influence sleep patterns, so. Question 6. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition. Select one that doesn't apply. Option A, alcohol use disorder. Option B, major depressive disorder. Option C, stomach cancer. Option D, polydipsia. The correct answer is option C, stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 7. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A, exposure and response prevention. Option B, dialectical behavior therapy. Option C, family therapy. Option D, interpersonal therapy. The correct answer is option A, exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 8. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A, encourage the patient to ignore the voices. Option B, provide a structured and safe environment. Option C, engage the patient in a debate about the reality of the voices. Option D, ask the patient to describe the content of the hallucinations. The correct answer is option D. Ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess. Question 9. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A. Deep breathing exercises. Option B. Physical exercise. Option C. Mindfulness meditation. Option D. Journaling. The correct answer is option A. Deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the vagus relaxation response, leading to. Question 10. A patient with major depressive disorder is being treated with electroconvulsive therapy (ECT). The nurse should monitor the patient for which common side effect? Option A. Memory loss. Option B. Hypertension. Option C. Weight gain. Option D. Hyperglycemia. The correct answer is option A. Memory loss. Memory loss, especially short-term memory loss, is a common side effect associated with electroconvulsive therapy (ECT). During ECT treatment, the electrical currents passed through the brain can disrupt short-term. Question 11. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be option A. Nursing Interventions Classification, NIC. Option B. Nursing Outcomes Classification, NOC. Option C. NANDI Nursing Diagnoses. Option D. DSM-5. The correct answer is option D. DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 12. Which activity is most appropriate for a child with ADHD? Option A. Reading an adventure novel. Option B. Monopoly. Option C. Checkers. Option D. Tennis. The correct answer is option D. Tennis. Children with ADHD often struggle with sustained attention, impulsivity, and hyperactivity, making it essential to select activities that align with their neurological needs while minimizing frustration. Tennis D. Question 13. A female patient diagnosed with schizophrenia has been prescribed a first-generation antipsychotic medication. What information should the nurse provide to the patient regarding her signs and symptoms? Option A. Her memory problems will likely decrease. Option B. Depressive episodes should be less severe. Option C. She will probably enjoy social interactions more. Option D. She should experience a reduction in hallucinations. The correct answer is option D. She should experience a reduction in hallucinations. First-generation antipsychotic medications are effective in reducing hallucinations in patients with schizophrenia. These medications primarily target positive symptoms such as hallucinations and delusions. Question 14. In the treatment of generalized anxiety disorder, GAD, what medication is frequently prescribed as a first-line treatment? Option A. Clonazepam. Option B. Buspirone. Option C. Propranolol. Option D. Hydroxyzine. The correct answer is option B. Buspirone. Buspirone is often chosen as a first-line treatment for generalized anxiety disorder GAD due to its efficacy and favorable side effect profile. Unlike benzodiazepines such as clonazepam A, buspirone does not. Question 15. A client is experiencing progressive changes in memory that have interfered with personal, social, and occupational functioning. The client exhibits poor judgment and has a short attention span. The nurse recognizes these as classic signs of which condition? Option A. Delirium. Option B. Mania. Option C. Parkinsonism. Option D. Alzheimer's. The correct answer is option D. Alzheimer's. The client's presentation of progressive memory changes, poor judgment, and attention deficits align with classic signs of Alzheimer's disease. Alzheimer's is a neurodegenerative disorder characterized by cognitive. Question 16. The mental health team is determining treatment options for a male patient experiencing psychotic symptoms. Which question shouldn't the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Option A. Is the patient expressing suicidal thoughts? Option B. Does the patient have intact judgment and insight into his situation? Option C. Does the patient have experiences with either community or inpatient mental health care facilities? Option D. Does the patient require a therapeutic environment to support the management of psychotic symptoms? The correct answer is option C. Does the patient have experiences with either community or inpatient mental health care facilities? Assessing suicidal thoughts, judgment, insight, and the need for a therapeutic environment are crucial factors in determining the appropriate treatment setting for a patient experiencing psychotic symptoms. Past. Question 17. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A, fluoxetine, Prozac. Option B, isocarboxazid, Marplan. Option C, amitriptyline. Option D, duloxetine, Cymbalta. The correct answer is option A, fluoxetine, Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for Tammy due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor SSRI class of. Question 18. A patient with generalized anxiety disorder, GAD, is prescribed buspirone. The nurse understands that buspirone is different from benzodiazepines because it, option A, has a high potential for abuse. Option B, works immediately to relieve anxiety. Option C, does not cause sedation. Option D, is used for short-term treatment only. The correct answer is option C, does not cause sedation. Buspirone is different from benzodiazepines because it does not cause sedation. Unlike benzodiazepines, buspirone has a lower potential for abuse and does not cause the sedative effects commonly seen with. Question 19. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A, restating. Option B, encouraging description of perception. Option C, summarizing. Option D, asking why questions. The correct answer is option D, asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot. Question 20. During a routine health screening, a grieving widow whose husband died 15 months ago reports emptiness, a loss of self, difficulty thinking of the future, and anger at her dead husband. The nurse suggests bereavement counseling. The widow is most likely suffering from option A, major depression. Option B, normal grieving. Option C, adjustment disorder. Option D, post-traumatic stress disorder. The correct answer is option C, adjustment disorder. The widow's symptoms align more closely with an adjustment disorder rather than major depression, normal grieving, or post-traumatic stress disorder. The widow's prolonged struggle in coping with the loss. Question 21. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A, lithium escalate. Option B, clozapine, Clozaril. Option C, diazepam, Valium. Option D, amitriptyline. The correct answer is option A, lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 22. A male patient calls to tell the nurse that his monthly lithium level is 1.7 milliequivalent/L. Which nursing intervention will the nurse implement initially? Option A, reinforce that the level is above the therapeutic range. Option B, instruct the patient to hold the next dose of medication and contact the prescriber. Option C, advise the patient to go to the hospital emergency room immediately. Option D, inform the patient about the possibility of seizures and appropriate precautions. The correct answer is option B, instruct the patient to hold the next dose of medication and contact the prescriber. A lithium level of 1.7 meql is above the therapeutic range, indicating a potential risk of toxicity. The initial nursing intervention should be to instruct the patient to hold the next dose of medication and. Question 23. In managing a patient with anorexia nervosa, which initial treatment goal is most important? Option A, addressing distorted body image. Option B, restoring nutritional status. Option C, resolving family conflicts. Option D, increasing social interactions. The correct answer is option B, restoring nutritional status. The most crucial initial treatment goal for anorexia nervosa is restoring nutritional status. This is essential to prevent life-threatening complications associated with severe malnutrition, such as organ damage and. Question 24. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 25. Which medication is commonly prescribed for the treatment of panic disorder? Option A, haloperidol. Option B, clonazepam. Option C, lithium. Option D, fluoxetine. The correct answer is option B, clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous